Hello and welcome back to PodcastDX, the show that brings you interviews with people just like you whose lives were forever changed by a medical diagnosis. I'm Lita. Ron will not be with us today.
And I'm Jean Marie. Today we are going to delve into a fascinating but often overlooked part of the human body, the lymphatic system.
Yes, that's right. Most of us learn about the heart and the blood vessels in school, but the lymphatic system works quietly alongside of them every minute of every day. It's crucial for fluid balance, waste removal, and immune defense.
Exactly. First, we'll explore where the lymphatic system is found in the body, how it was discovered, what it looks like, and what it actually does. The lymphatic system was first described in ancient Greece, but it wasn't really understood until approximately the 1600s. Early anatomists noticed clear fluid in the body's tissues, but didn't know what it was for.
In 1622, an Italian physician
I'm waiting for this one.
named Gasperi Acelli discovered what he called milky veins in the intestine of a dog during a dissection.
Poor dog.
These were actually lymphatic vessels carrying fat-rich lymph called chyle.
A few decades later, someone in Sweden and someone in Denmark mapped out the human lymphatic network. Their work proved that the body has not one, but actually two circulatory systems, one for blood and the other for lymph.
It took modern microscopy to show that lymph is not just fluid, it's an active transport system full of immune cells that protect us from infection.
The lymphatic system runs throughout one's entire body, forming a vast network of vessels that parallel the veins and arteries.
It's made up of lymphatic vessels, lymph nodes, we've all heard of lymph nodes, and several specialized organs, the spleen, the thymus, the tonsils, and bone marrow. Together, they produce and circulate lymph, which is a clear, watery fluid that carries immune cells, proteins, and waste.
Unlike the blood, which is pumped by the heart, lymph moves slowly and relies on muscle contractions, breathing, and one-way valves to flow in a single direction, upward toward the heart.
This is why people with lymphedema typically have large legs, because they're the furthest from the heart. The largest lymphatic vessel, the thoracic duct, collects lymph from most of the body and empties it into a large vein near the collarbone where it rejoins the bloodstream.
Lymph typically looks like a pale straw-colored liquid, clear in most areas, but milky after you've eaten when it absorbs fat from the intestine.
Then that's part of its job. The lymphatic system helps transport fats and fat-soluble vitamins from the digestive tract into the bloodstream. It also collects extra fluid that leaks from blood vessels into tissues and returns it to circulation, preventing swelling.
Another key function is immunity, which I think is what most people think of when they think of the lymph system.
Yes.
Lymph carries white blood cells, especially lymphocytes, which patrol for bacteria, viruses, and abnormal cells.
It's nice that they call it lymphocytes. So we know that they're connected.
Oh, okay.
All right. When the body detects a threat, those immune cells multiply and mount a defense. That's why your lymph nodes sometimes swell when you're fighting an infection. They are literally working overtime.
And let's talk about the organs involved in the lymph system. The thymus, located behind your breastbone, is where certain immune cells called T cells mature.
And the spleen in the upper left abdomen filters blood, removes old red cells, and helps detect invading microbes. The tonsils and adenoids act like gatekeepers, trapping germs that enter through the mouth and nose.
Even bone marrow is part of the lymphatic system, producing the stem cells that become white blood cells.
And altogether, it's like an internal security network, screening, filtering, and responding to potential threats before they spread.
So what's the overall purpose of the lymph system? In short, the lymphatic system maintains balance and defense. It removes waste products, regulates fluid, absorbs fats, and plays a central role in the immune system.
Without it, our tissues would swell up with trapped fluid. Fats couldn't reach the bloodstream efficiently, and infections could spiral out of control.
The lymphatic system is constantly working behind the scenes, clearing debris, identifying pathogens, and even helping the body recover after injury or surgery.
It's the body's silent janitor and security team all rolled into one.
Okay.
Oh, well, so let's talk about what happens when that system runs into trouble.
Okay.
When it's injured, infected, or overwhelmed by a disease. Because the lymphatic system is responsible for draining excess fluid and filtering out waste, any blockage or damage can cause serious problems.
Yes. When lymph can't flow properly, it builds up in tissues, causing swelling known as what you mentioned earlier, lymphedema. And this can happen anywhere in the body, but is most common, as you mentioned earlier, in extremities like the arms and legs.
Lymphedema often develops after a surgery or radiation therapy for cancer, especially for breast, pelvic, or prostate cancers, because the lymph nodes are removed or scarred.
There's also primary lymphedema caused by genetic abnormalities in lymph vessels, and it can appear at birth, during puberty, or later on in life without any indication of an injury to the lymph system.
Because lymph nodes act as filters for germs, they can become inflamed or infected themselves, a condition called lymphadenitis. Lymphadenitis? Okay, close enough.
That's why swollen lymph nodes are such a common sign of infection, whether it's strep throat, mononucleosis, or even skin infections like cellulitis.
In these cases, swelling means that the immune system is working. The lymphocytes inside those nodes are multiplying rapidly to fight whatever organism is invading.
Sometimes the infection spreads within the lymphatic systems or lymphatic channels, causing red streaks under the skin. That's called
lymphangitis.
And it needs prompt medical care.
The lymphatic system is also closely tied to autoimmune diseases and conditions where the immune system attacks the body's own tissues.
In diseases like rheumatoid arthritis, lupus, and Hashimoto's, the lymphocytes become overactive and target healthy cells. That chronic inflammation can cause fatigue, joint pain, and swollen lymph nodes.
Chronic inflammation puts stress on the lymphatic network, sometimes slowing the drainage and making the body more prone to infection.
Unfortunately, cancers that begin in the lymphatic system itself, Hodgkin's lymphoma and non-Hodgkin's lymphoma, are two main types of cancer that can affect the lymphatic system.
Okay. And both of those start when lymphocytes, which are the white blood cells inside the lymph nodes, begin to multiply uncontrollably, like any other cancer, just uncontrolled multiplication. The difference between them comes down to the specific type of cell involved and how it looks under a microscope. That's either Hodgkin or non-Hodgkin.
Hodgkin lymphoma often shows up as a painless swelling in the neck, armpit, or groin and tends to spread in an orderly fashion from one node group to another.
Non-Hodgkin lymphoma, on the other hand, includes many subtypes that behave differently. Some are very slow growing and others are quite aggressive.
And then there are also secondary cancers where other types of cancer, like breast cancer or liver cancer, spread to the lymph nodes. This doesn't mean the cancer started in the lymph system, but it means that those nodes are doing their job, trapping the cancer cells that have traveled through the lymph fluid.
And when something is wrong in the body, the lymph nodes often provide the first clue. Doctors can sometimes feel enlarged lymph nodes in the neck, armpits, or groin during a physical exam.
Nodes that are small, tender, and movable often point to infection. Firm, fixed, or painless nodes may suggest something more serious like cancer or chronic inflammation.
Imaging studies like ultrasound, CT, or PET scans help visualize deeper lymph nodes, and biopsy is usually used to determine whether the cells inside are benign or malignant.
Interestingly, lymph nodes can also scar after repeated infections, and over time, the scarring changes how effectively they filter lymph.
Even trauma or surgery can disrupt lymph flow. When lymph vessels are cut or scarred, fluid can't move freely. That leads to chronic swelling and tissue changes.
And that's why surgeons today often use imaging dyes or fluorescent tracers to map the lymphatic system before removing tissue. It helps to minimize the risk of accidental damage.
Well, that's good to know. Radiation can also stiffen or narrow lymph vessels, causing delayed swelling months or even years after treatment.
There are also metabolic or systemic diseases that affect lymphatic function. For example, congestive heart failure, liver disease, or liver cirrhosis can all overwhelm the lymph drainage and the lymph system and cause generalized swelling.
Some rare genetic disorders like Milroy disease or Meige, M-E-I-G-E disease result in defective lymphatic vessel development. They're uncommon, but they remind us how essential this system is to normal physiology.
So we talked about what happens when the lymphatic system runs into trouble, from infections to autoimmune diseases to cancers or even injury. Those swollen lymph nodes or lingering bouts of swelling are more than just cosmetic. They're the body's warning system that something deeper might be going on.
I think we're going to keep going again.
Okay.
Whether you're recovering from an illness, living with a chronic condition, or just want to stay healthy, there's a lot you can do to keep your lymph flowing.
Okay.
The lymphatic system doesn't have a heart to pump it like we talked about.
Mm-hmm.
So movement, like body movement,
Right.
walking, exercising, and hydration, staying hydrated so that your bodily fluids don't get sticky and thick. When lymph flow slows, waste and fluid can build up, causing fatigue, swelling, or increased susceptibility to infection.
And supporting the lymphatic system is about improving circulation, reducing inflammation, and keeping the body's detox pathways open.
One of the best ways to keep lymph moving is to move yourself. Every muscle contraction helps push lymph through those one-way valves toward the chest. Is that what those leg wraps do in the hospital?
Yeah. Well, they also keep blood flowing.
Okay.
Yeah. They're supposed to prevent like blood clots forming in the legs because you're not up and walking maybe as much
Right.
as you would
Right.
normally. Walking, swimming, cycling, stretching, yoga, even gentle rebounding on a mini trampoline can all help. The idea is regular movement, not intensity.
So just doing it like on a scheduled basis, right?
And yeah, just doing a little bit, starting at, I know there's at least one influencer online who shows that, her doctor was saying, oh no, you can't do anything. But she found that with, if her leg was supported properly and, braced properly, she could, start on a mini trampoline for like just, 30 seconds and then build up to, 15 minutes. And it made a significant impact on her lymphedema.
Okay, good to know.
But consult your healthcare provider and see what they suggest and work with your physical therapist and massage therapist if that's applicable.
Okay. Deep breathing also helps because the pressure changes in your chest when inhaling and exhaling create a natural vacuum that draws lymph upward.
And as we had kind of touched on earlier, because lymph is mostly water, dehydration slows the flow. So most adults need maybe 64 to 80 ounces of fluids per day, depending on your healthcare status or your health status, depending on the activity and the climate you're living in as well.
Water is the best, but herbal teas and low-sugar electrolyte drinks can also help. Limiting alcohol and caffeine prevents dehydration and supports healthy tissue balance.
And in terms of diet and nutrition, the goal is to aim for colorful fruits and vegetables high in antioxidants. Berries, leafy greens, citrus, omega-3 fats from fish or flaxseed can help reduce inflammation, and fiber can help the gut eliminate toxins more effectively.
Try to limit processed foods. We've been saying that a lot lately.
Mm-hmm.
Try to limit salt and refined sugar, all of which can cause fluid retention and make lymphatic swelling worse.
For people who are living with lymphedema or sluggish lymph flow, manual lymphatic drainage, or MLD, can make a significant difference.
Is that what they do in those clinics?
Well, why don't you tell us?
Okay. There's a specialized type of gentle massage that moves fluid from congested areas toward healthy drainage points.
Okay.
Certified lymphedema therapists are trained to perform that procedure safely.
Some patients may also benefit from compression garments, bandaging, and pneumatic pumps that apply gentle pressure to encourage flow.
These are especially helpful after surgery or radiation when lymph channels are damaged or blocked.
When lymph flow is impaired, even small cuts can lead to infection. So good skincare is also vital. Keeping the skin clean and moisturized is important. Also, avoid walking barefoot outdoors and always treat small wounds right away.
People with chronic swelling should avoid tight clothing or jewelry that can restrict flow, especially at the joints.
Mm-hmm.
Elevating the affected limb and practicing gentle range of motion exercise also helps.
Obesity and chronic inflammation both put extra stress on the lymphatic system. Fatty tissue can actually compress lymph vessels and slow drainage.
That's why maintaining a healthy weight through a balanced diet and exercise is so important. It helps both the circulatory and the lymphatic system function efficiently.
Anti-inflammatory habits, such as avoiding smoking, limiting one's alcohol intake, and getting enough sleep, all support lymph health as well.
Some people use complementary therapies to support lymph flow, such as infrared sauna, dry brushing, or gentle yoga.
Dry brushing uses soft, natural bristle brushes to make light upward strokes towards the heart, for example, like before showering. It stimulates the skin and may help with superficial lymph movement, although scientific evidence here is very limited.
The key is to be gentle, no harsh scrubbing or deep pressure. Think of it as encouraging the body's natural flow, not forcing it.
Right. I know I often will put my feet up to help improve my lymph flow.
Okay.
Persistent swelling, redness, pain, or hardening of tissues should always be checked by a healthcare provider. These could be signs of infection, lymphatic damage, or an underlying heart or kidney problem. If your socks are cutting into your legs, it might, I would say it's time to check with the healthcare provider.
Correct. Likewise, if lymph nodes stay enlarged for more than a couple of weeks, or if they grow rapidly, see your doctor for evaluation. Most cases are benign, but some may require further investigation.
The lymphatic system is one of the body's hardest working, but least understood, or at least commonly spoken about networks. It's constantly clearing waste, balancing fluids, and supporting one's immunity. Yet, it's easy to take it for granted.
A few daily habits like staying active, drinking water,
Eating
what?
Healthy, balanced diet.
Healthy, balanced diet.
Mm-hmm.
Okay. All right. And taking care of your skin can keep your lymph system working smoothly for decades.
Well, hopefully, yeah, for a century or so. For people living with lymphedema or specific immune conditions, consistent self-care and medical follow-ups can make a huge difference in comfort and long-term outcomes.
So to wrap up, we learned how the lymphatic system was discovered in the 1600s and what it does. We explored diseases and injuries that can affect it. And we covered ways to care for it through movement, hydration, nutrition, and awareness.
The lymphatic system may be silent, but it's one of the most essential systems for keeping us healthy, strong, and balanced.
Exactly. So take care of it, and it'll take care of you.
Thank you for taking the time to join us today.
Please visit us at PodcastDX.com to learn more and find additional health resources.
As always, this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime. Never disregard professional medical advice or delay in seeking it because of something you've heard in this podcast.
Till next week.